In this video, I'm going to be talking about paralysis and its treatment. So what does the word paralysis mean? Paralysis means loss of function of a group of muscles. It can also have an impact in terms of the sensation. Though primarily paralysis refers to the loss of muscle function, as I said, it can very often also lead to loss of sensation in the particular or sensory phenomenon in that part that is affected. The common causes of paralysis are stroke, spinal injury, multiple sclerosis and a whole lot of neurological diseases that result in this loss of muscle function. But very vaguely or colloquially, people refer to stroke, brain stroke, by the word paralysis. Paralysis can be again classified based on the parts that are affected. You can talk of monoplegia where only one arm or one leg is affected. It's called hemiplegia when one side of the body is affected, for either the left side of the body is affected or the right side of the body is affected. In that case it is called as hemiplegia, which is one of the common manifestations of stroke which results in paralysis. There is also paraplegia where both the lower limbs are affected and quadriplegia where all the four limbs are affected. So this is a way of classifying the types of paralysis based on the location. Paralysis can also be classified on the basis of the intensity, on the basis of the severity of the problem, as well as the duration of the problem. So now let us talk about paralysis that is caused by stroke, which is the most common cause of paralysis, and its treatment. Stroke is very commonly a result of two incidents that happen in the brain. The one which is the most common is that block that happens in a blood vessel that supplies to the brain, and that is called as a thrombotic stroke. And the next is when a blood vessel supplying the brain bursts and the blood oozes out of that burst blood vessel, and that condition is known as a hemorrhagic stroke. These are the two common varieties of stroke that result in paralysis. Paralysis can also be transient in nature in some cases, in which case it is called as a transient ischemic attack and so on and so forth. But we are now limiting ourselves to speaking about stroke, which is of a more intense nature, as what happens with the thrombotic stroke or a hemorrhagic stroke. One of the first and important things to be held in mind with respect to stroke is the moment a person is seen to be suffering from stroke, he needs to be rushed to a hospital, especially one that has got a neurology specialty. There are wonderful medicines available in modern medicine today which are capable of dissolving the clot in case it is one. The faster the patient is taken to the hospital, the higher the chance of a complete reversal. With the administration of these clot busters, it is possible to completely dissolve the clot and save the parts of the brain which could otherwise get affected due to lack of oxygen supply. In that case, the patient can be completely reversed from the condition and can be totally symptom free. In the case of a hemorrhage, it's not that easy, because the oozing of the blood has to stop, and then the blood that is accumulated has to be either spontaneously allowed to recede or surgically the bleed is arrested and the clot or the amount of blood that is collected is removed through a surgical procedure. And within that time, a part of the brain that suffers from lack of oxygen is already affected, leading to the symptoms that are typically paralytic in nature. So there is this approach of an acute paralytic attack, in which case the patient is taken to the hospital, to a neurology center, and is to be handled. Very often, once the critical phase is over, even if the patient is taken late to the hospital, the vital parameters are normalized and the patient is taken to a stage where he is free from danger. And thereafter comes the second phase of the treatment of a paralytic patient or a stroke patient, and that is called as the rehabilitation phase of stroke. Very often, initial stages of rehabilitation start from the hospital itself, because the patient's lack of movement while at the hospital itself will deteriorate the functioning of the muscles of the body. Thereby, some level of rehabilitation is already initiated even while the patient is admitted in the hospital. But a major part of the rehabilitation is done thereafter, after the patient is discharged from a hospital. There are several very effective rehabilitation techniques in vogue today with the help of other aids as well. Physiotherapy is one of the most important rehabilitation techniques which are used post the stroke phase in conventional medicine. Physiotherapy deals with re-establishing the efficacy of movement, efficacy of using the muscle groups and getting back the activities of daily living through the passive and active involvement of muscles led by a physiotherapist. There are also several equipments that can aid the physiotherapist in this journey of rehabilitation. A team of rehabilitation therapists comprises of a physiotherapist, then an occupational therapist. Occupational therapist is a specialist on working with the hands and in the minute or fine motor skills as we call them. While a physiotherapist works on the gross motor skills, the occupational therapist works on the fine motor skills, enabling the patient to regain the fine actions that are required as part of their activities of daily living. The third very important member in the team is a speech therapist who helps to restore the ability to speak in a patient whose right side is affected. Generally, a right-sided stroke also leads to a loss of ability to speak. When the left part of the brain is affected, the right stroke happens, and because the speech center is located in the left side of the brain, a patient suffering from a right side stroke very often loses his speech. And in those cases, the role of a speech therapist becomes extremely important in getting the patient back to the ability to speak. So the earlier these rehabilitation techniques are initiated, the better is the recovery. It also depends on the extent of brain that is damaged due to the acute episode that has happened. In this context, I would like to speak about how Ayurveda can contribute to this process of rehabilitation. Ayurvedic treatment has been very popular over the years for its ability to treat neurological diseases, especially in helping patients with stroke to rehabilitate much better. Ayurveda has been used as a standalone treatment in several patients to rehabilitate stroke patients and has been quite effective in the same. It enables the patient to regain their motor functions and sensory impairments to a great extent even as a standalone therapy. But we at AVN Arogya integrate the modern rehabilitation techniques of physiotherapy, occupational therapy and speech therapy with Ayurvedic treatment to make it even a more holistic and comprehensive solution to patients who are suffering from paralysis due to brain stroke. This sort of combination enables the patient to rehabilitate much faster and to a much better degree than would be otherwise possible with only one or two of these rehabilitation techniques as standalone. In the meanwhile, all the vital parameters are kept under control with the use of modern medication as well, as per the advice of the neurologist who is already treating the patient. So we continue to treat the patient, giving them those drugs that they are on to stabilize their blood pressure, to stabilize their diabetic condition if they are suffering from that, and so on and so forth, to stabilize their renal function in case they need support in that area. So whatever are the drugs that are required, again there are drugs to prevent the clotting of blood, to prevent further episodes of stroke from happening. So there is a group of medicines that are prescribed to a patient who is suffering from stroke, and we continue to administer those medicines to them even as they are undergoing our Ayurvedic treatment along with the rehabilitation therapies. This combination, we are able to see, is able to help the patients recover back to their normal functioning much faster and in a much better degree than when we just use each of these parts separately. This is what we at AVN Arogya offer as a solution for paralysis that is because of brain stroke. We also treat paralysis that happens due to other neurological conditions like spinal injury. Post the acute phase, when surgery is recommended, surgery is definitely the best option in a spinal injury. And to the extent that the recovery is possible through surgery, we allow that to be happening first. Following which, if there is a residual abnormality, we help the patient rehabilitate back to normal, combining these rehabilitation techniques and the Ayurvedic treatment procedure as an additional and a holistic approach to rehabilitating paralytic patients due to spinal injury. We also offer treatment for other neurological diseases like multiple sclerosis or Guillain-Barré and so on and so forth. Several neurological diseases that result in paralysis of different groups of muscles. And we are able to use Ayurvedic treatment and the rehabilitation techniques hand in hand to rehabilitate those patients who are suffering from various types of paralysis. Even paralysis in children, which is commonly known as cerebral palsy, very well responds to this holistic sort of treatment that we are able to offer in Ayurveda. It is not that it's a complete cure for the condition, but the patients are able to get back to their to the much better level of functioning than which is otherwise possible.
Go here to subscribe.